Hello everyone, here Dr. Manisha. Today we are reviewing mystery behind Anand Bhairav Ras, one of the Ayurveda's most potent herbal mineral formulation. Whether you are an Ayurvedic student, practitioner or pharmacy enthusiast, you have likely noticed that its composition changes drastically depending on whether you are treating Kasa-Shwasa or Atisara. Now we see here two formulations about Anand Bhairav Ras. First use indicated for Shwaska Atisara, which is Hingulam cha Visham Yosham Tankanam Gandhakam Samam Jambir Rasa Sanyutam Mardayet Tvayam. Ingredients is here Hingul, Vatsanap, Vyosha means Trikatu, Shunthi Marich Pipali, Tankan Lahi, Gandhak. The processing is here. All these ingredients are taken equal parts and triturate with Jambir Swaras for 2 prahar, that is approximately 6 hours, and use in managing Kasa-Shwasa Atisara. Also in Bhaishajya Ratnavali, indication of this formulation is Kasa-Shwasa Atisareshu Grahanyam Sannipatike Apasmare Anile Mehe Api Ajirne Vanni Mandake Gunja Matraha Pradatavyo Rasa Anand Rasaha. Means dosage here is a 1 gunja which destroys Atisara and Meha. Now one more formulation is present in Rasa Yoga Sagara, indicates specifically for Atisara, which is Hingulam Vatsanabam cha Maricham Tankanam Kanam Mardayet Samabhagam cha Raso hi Anand Bhairavaha Gunjekva Dvigunjava Bala Nyatva Prayojayet Maduna Lihayet Chanu Kutajasya Falatvacham Churnitam Karshmatram tu Tridoshatha Atisaranut Dadhyannam Dapayet Pathya Gogrutam Takram Evacha Pipasayam Jalam Shitam Vijayam cha Hitanishi. Here ingredients is in it, that is Hingul, Vatsanap, Marich, Tankan, Kana means Pipali, and all these ingredients are taken as in equal parts, and in processing all these dry trituration and mix with Quath of Indrayav or Kutas Sal for trituration. Dosage is here 1 to 2 gunja, approximately 125 to 250 milligram, and Anupana honey, and followed by 1 kirsch powder of Kutaj Phala or Sal to cure severe Atisar caused by Tridosha Samutha Atisar. And Pathya is mentioned in this shloka, that is a curd rice, cow ghee, takra. Now we see some research article related to Anand Bhairav Ras. First article is comparative study of different Anand Bhairav Ras and its standardization with respect to Bhaishajya Ratnavali reference. In Ayurveda has been using Anand Bhairav Ras for centuries. The management in Atisara, Grahani and Jwaratisara. Although this medicine is well described in the classical text, Bhaishajya Ratnavali mentioned 2 different formulations in separate 2 chapters. That is the one in Atisara and one is in Jwaratisara chapter. To answer this, researcher conducted comparative pharmaceutical and physicochemical standardization study. Rather than evaluating the medicine's clinical effectiveness, the study focused on establishing quality standards, ensuring reproducibility and providing scientific evidence for manufacture consistency. Here 2 different formulations, one in Jwaratisara Prakarana and another in Atisara Prakarana in Bhaishajya Ratnavali. Since both formulations have different ingredients and preparation method, researcher wanted to know, are both formulations prepared properly? Do they have the same quality, or how are they chemically different? Can standard quality parameters be established for future manufacturer? Without standardization, the quality of Ayurvedic medicine may vary from one manufacturer to another. Here the purpose of this researcher to study the standardized Anand Bhairav Ras, specifically want to compare 2 classical formulation, study pharmaceutical differences, evaluate physical characteristics, analyze chemical properties, establish standard quality control parameters and ensure safety and reproducibility. And objective is here, first objective to compare 2 different classical formulation described in Bhaishajya Ratnavali, and second objective is to establish standard pharmaceutical and physicochemical parameters that can be used to reference values for quality control. Now deep dive in methodology. First step is to collect the raw material. Ingredients here: hingul, gandhak, tankan, vatsanab, marich, pipali, shunti. All these herbs drug authenticated by experts and to confirm their purity. Second step is a authentication of minerals. Before preparation, mineral ingredients underwent to laboratory testing. Hingul, which contains approximately 86.1% mercury. Gandhak, testing showed approximately 98% sulfur, and in Tankan, confirmed by green flame test and pH analysis. Third step is a purification. Since Anand Bhairav Ras contains minerals and poisonous ingredients, purification was so mandatory. First, we purify hingul using Swedan in Dola Yantra, use lemon juice, goat urine, and after that hot water wash, and you may get pure hingul. Second is the gandhak purification. Purify by melting in cow ghee, followed by pouring into cow milk and washing with warm water. Then tankan, purified by using specific procedure in kanji, cow urine, lemon juice. And one more, vatsanab, purified by soaking in cow urine under sunlight and removing the outer layer, toxic layer. Then fourth step is preparation of these two formulation. Formulation first, according to Jwaratisara chapter, ingredients is hingul, gandhak, tankan, vatsanab, trikatu, and bhavana given with jambir lemon soras. And formulation B, which is according to Atisara chapter, that is a hingul, vatsanab, tankan, marich, pipali, not use sunthi and only use, not use sunthi, and bhavana was given here with jal. The fifth stage is prepared these samples, improve reliability, prepare 3 batches of both formulation A and B. Total 6 independent samples prepared for reduce experimental error and improve reproducibility. Sixth step is a organoleptic evaluation. Each sample was evaluated for color, odor, taste and texture. And findings in formulation A, which is reddish brown, pleasant smell, smooth texture and strong pungent taste, and in formulation B, which is brick red, faint smell, smooth texture and mild pungent taste. The differences occur because of different ingredients in it. And step 7, which is a physicochemical analysis. This test includes pH, measures acidity or alkalinity. Results in formulation A, which is approximately 7.30, nearly neutral, and in formulation B, which is approximately 9, more alkaline in nature. Loss on drying measures moisture content, which results in formulation A, which is higher moisture around 12 to 14%, and in formulation B, lower moisture around 10 to 11%. Ash value indicates total inorganic matter. Both formulations showed acceptable value around 13 to 15%. In acid insoluble ash measures silica and dirt contamination. All samples very low values, which indicates good purity. Water soluble extractive measures water soluble active constituents. In formulation B, showed slightly higher extractive values in it. And in alcohol soluble extractive measure alcohol soluble phytochemicals. Both formulations show similar values. Step 8, which is a heavy metal analysis, use ICP analysis. Elemental tests include chromium, copper, nickel, lead, cadmium, zinc and arsenic. That study conducted that all trace metals remains within safe limit according to the laboratory findings. Step 9, which is a TLC, because it confirms identity of herbal ingredients, presence of phytochemicals, batch consistency, purity of formulation. Different solvent system used here. TLC profile match the expected herbal ingredients, which confirming authenticity. The study produced several important findings here. Formulation A gained more weight during preparation because lemon juice was used for titration, and in formulation B showed less weight gain because water used instead it. In organoleptic results, both formulation differed in color, smell, taste because of different composition. In chemical result, both formulations showed difference in pH, sulfur content, moisture and extractive values. Yet all three batches of each formulation showed very similar values within their group. This means manufacturing process was highly reproducible. In standardization result, pH, ash value, moisture, extractive value, TLC fingerprints and heavy metal profile, these all can now use for future quality control. And in lastly concluded that this article, both formulations are pharmaceutically different, organoleptic and chemical characteristic also different. Despite these differences, each formulation produces highly consistent results across all three batches. Physicochemical values remain within acceptable pharmacopoeial standards. This study focused on pharmaceutical standardization and QC rather than evaluating clinical efficacy in patient. And in clinical importance, ensure not a clinical efficacy study, it has significant clinical relevance. First, ensure consistent quality. Standardize, ensure every batch Anand Bhairav Ras has consistent composition, reducing variability in patient treatment. Improve safety, support evidence-based Ayurveda, facilitate quality control and build confidence for future research. Now we see a second research article, which is a compared analysis of two Vatsanab Shodhan approaches. Whenever we prepare Ayurvedic medicine, one important question arises: will every batch prepared by different manufacturer have the same quality? For herbal medicine, slight variation in raw material or preparation method can produce different products. This becomes more important in herbal mineral formulation like Anand Bhairav Ras because it contains Vatsanab, which is naturally poisonous before purification, and different purification methods for Vatsanab, using cow urine and also using cow milk, but no study had compared whether these two purification methods produce the same medicine or chemically different medicine. Therefore, research was conducted. Main purpose of this study was to compare the effect of two different purification methods of Vatsanab on the final product of Anand Bhairav Ras. Researcher wanted to determine whether using Gomutra and Godugdha changes its pharmaceutical properties or chemical characteristics or chromatographic profile or quality of the final formulation. This study was not designed to prove clinical efficacy, only for pharmaceutical standardization study. First objective here to compare Anand Bhairav Ras using two different purification methods, and secondary objective to compare physicochemical properties, compare organoleptic characteristics, evaluate purification induced changes, to compare chromatological fingerprint using TLC, HPTLC to establish quality standards for manufacturing. And we see further detailed methodology. First step is a collection and authentication of raw material. Collect Vatsanab, Hingur, Tankan, Marich, Pipali and lemon for authenticated supplies. Step second is a purification of Vatsanab. Most important part is here. First group is a Gomutra Shodhit Vatsanab. Procedure is here. Tuber were cut into small pieces, immersed in fresh cow urine, kept under sunlight. Cow urine replaced every day, continue for 3 days, wash with water, outer peel removed and sun dried, powder prepared. And second group is a Godugdha Shodhit Vatsanab. Procedure: tubers cut into small pieces, tied in cloth, suspended in Dola Yantra, boiled in cow milk. Temperature maintained around 100 to 110 degrees Celsius, 4 hours every day. Repeated for 3 days, washed, peeled, sun dried, powder prepared. And third step is a purification of other ingredients like hingur, which purified by 7 bhavanas with Jambiswaras, washing and drying. Then Tankan purified by heating, water evaporate. Fourth step is a preparation of Anand Bhairav Ras. Batch first prepared using cow urine purified Vatsanap, and other ingredients hingur, tankan, maric, pipali equal quantity taken. Jambir Swaras used for Bhavana, and tablet prepared. And batch second prepared similarly, but only use Vatsanap was purified using cow milk. Everything else remained same. Fifth stage is a analytical evaluation. First is a organoleptic analysis, studied color, odor, appearance, taste and touch. Physicochemical analysis, that is pH to determine acidity or alkalinity. Moisture content for water present in formulation. Total ash to estimate total inorganic matter. Water soluble ash to estimate water soluble minerals. Acid insoluble ash to detect silica or impurities. Uniformity of weight to check every tablet has similar weight. Hardness test for strengthen of tablet. Friability test to break during handling. Rekhapurnatva, Varitaratva test, and AS for using to estimate mercury and sulfur. PLC for perform for raw material Vatsanap, which is Gomutra purified and milk purified Vatsanap. Purpose to compare chemical fingerprint between these three ingredients. HPTLC perform on both Anand Bhairav Ras formulation. Purpose to compare complete phytochemical profile. Now we see the detailed result. First for purification procedure, significant chemical changes. Both purification method alters pH, water soluble extractive values, chemical compositions. To confirm, Shodhan is not merely washing, it chemically modifies the drug. Result second, which shows the TLC shows different fingerprints. Purified sample had chromatographic patterns different from raw Vatsanap. This indicates detoxification produced chemical transformation also. Result third is a HPTLC demonstrated different in final medicine. Although both formulation look similar, their chemical fingerprint were not identical. And fourth result is a tablet characteristic. Both formulations show similar colors, size, texture. However, small differences were observed in hardness and disintegration time. These changes may influence drug release. Result fifth is a physicochemical parameters, which differences in pH, water soluble extractive chemical profiling, because purification media influencing the composition of Vatsanap. Now we at the end conclude both purification methods successfully detoxify Vatsanap. However, cow urine and cow milk purification produces chemically different Vatsanap, resulting in two distinct Anand Bhairav Ras formulation with different physicochemical and chromatographic characteristic. Although tablet appears similar in physical appearance, laboratory analysis confirm major difference in their chemical profile and tablet properties. So emphasize here further quantitative studies and well designed clinical trial are so necessary here. And in clinical importance, ensures safe use of Vatsanap for proper Shodhan essential here. Improve standardization, support scientific validation, and guides manufacturer foundation for future clinical research. Now we see here article 3rd, which title is a review article on Anand Bhairav Ras with special reference to Bhaishajya Ratnavali. The study was conducted because Anand Bhairav Ras is important Ayurvedic herbal mineral formulation used for treating Jwaratisara and Jwaratisara. Different Ayurvedic classical texts mention variation in its ingredients and therapeutic indication. Author wanted to collect and review available classical references of Anand Bhairav Ras, explain composition according to Bhaishajya Ratnavali, understand how its ingredients work based on Ayurvedic pharmacological principle, and highlights the probable clinical importance in digestive disorder and fever. Here the purpose of this study to comprehensive understanding Anand Bhairav Ras, especially described in Bhaishajya Ratnavali, which includes ingredients, pharmacological properties, indication, mode of action according to Ayurveda, and clinical usefulness. Objective is here to review classical reference, to describe formulation given in Bhaishajya Ratnavali, to explain Ayurvedic properties of each ingredient, to understand the probable mode of action in Jwara and Atisara, to evaluate its therapeutic significance based on classical literature. Now we see here detailed methodology, the review study, not experimental or clinical trial source of information, which is a all textbooks, Bruhatrayi and Lagutrayi. Step followed here. First step, to collect all references regarding Anand Bhairav Ras from classical Ayurvedic texts. Step 2, compare different formulation mentioned in different texts. Step 3, which select the formulation described in Bhaishajya Ratnavali because it is commonly used in research. Then formulation reviewed ingredients which is mentioned: Shuddha Hingul, Shuddha Vatsana, Gandhak in Jwaratisara formulation, Tankan, Shunti in Jwaratisara formulation, and people in Marich. Means in only Atisara formulation no use of Gandhak and Shunti, and here Bhavana, Jambir, Nimbuswaras, Anupana, honey, and Indraya Churna. In drug analysis, each ingredient was studied for botanical, chemical identity, Rasagun, Virya, Vipak, and Ayurvedic actions. Disease review to pathophysiology of Atisara, pathophysiology of Jwar, and role of Agnimandya and Am. Results here: the most ingredients are Dipan and Pachan drugs, which improve digestive fire and digest Am and correct Mandagni. Most ingredients possess Ushna Virya, which helps stimulate digestion, reduce kapha, balance Vata, and improve metabolism. And ingredient wise therapeutic action, C. Hingul is act as a Agnivardhak, Pachak, and useful in Jwaratisara. Vatsana, which act as a Dipan, Kapha-Vathara, useful in Agnimandya and fever. In Tankan, improves liver function, Dipan Pachan. Pipali, Rasayan, immunomodulator, Jwarahar and Shulahar. Marich act as a Dipan Pachan, Kapha-Vathar, and Ampachan. Overall pharmacological action, the formulation mainly act by increasing digestive fire, digesting Am, correcting Vat Kapha imbalance, reducing diarrhea, and reducing fever. Conclude here, Atisara develops mainly due to Mandagni, Am, and Vat Kapha dosha. Anand Bhairav Ras work by breaking this pathological process through Dipan, Pachan, and dosh balancing. The authors conclude here, the Anand Bhairav Ras is an important Kharaliya Rasayan, and different classical texts mention slightly variations in ingredients. The formulation described in Bhaishajya Ratnavali is simple, effective, and widely acceptable. In particular, use in Jwar, Atisara, and Jwaratisara and Mandagni. Effectively is mainly due to its Dipan, Pachan, Agnivardhak, Am Pachan, and Vata Kapha balancing properties. Now we see here the clinical applications. According to review, Anand Bhairav Ras is clinically applied in gastrointestinal disorders like Atisara, Jwaratisara, Grahani, Mandagni, Ajirna. In fever, Jwar, Pitta Jwar, Kapha Jwar, Ama Jwar. In digestive disorder, Am related disorder, loss of appetite, poor digestion, and in respiratory disorder, Kasa-Shwasa, musculoskeletal disorders in Amvat, and Pliha Rog and Shul, also other conditions to use the Anand Bhairav Ras. So to wrap it all up, while both formulation heavily on Hingul, Vatsanab, and Tankan, adding Gandhak and Shunti with a Jambir Swaras trituration completely shift to action towards respiratory and digestive fever. On the flip side, keeping it strictly to equal parts without Gandhak and triturate with Indraya or Kutaj makes it a laser focus remedy for Atisara. So if you found this breakdown helpful, hit that like button, subscribe to the channel for more Ayurvedic formulation deep dives, and drop your questions or topic request in the comments below. Until next time, stay healthy and keep learning. Bye.